Please share, like and subscribe. According to a recent report from the US government Centers for Disease Control and Prevention, more than 20% of male and female adults in the US smoke cigarettes, while more than 80% of them light up a cigarette daily. The reason why smoking has become such an issue is because the addictive consequences of nicotine lead to assorted types of cancers, strokes, and heart attacks. As such, every day is the correct time to stop smoking. Smoker's Sanctuary: save your lungs and never have to spend a single cent of ciggies ever again. 1. Why people want to quit. Smokers have presented a throng of reasons for wishing to quit smoking. The reasons: several had to stop for medical purposes. This isn't surprising considering that over 400,000 Americans die yearly from diseases induced by cigarettes. Among the more common ailments directly caused by smoking are heart conditions, cancers, strokes, peripheral vascular diseases, pulmonary emphysema, bronchitis, ulcers, and others. Additionally, treatment of pre-existent conditions may be complicated by smoking. Risk of anesthesia and post-operative ramifications are increased by utilization of cigarettes. Social pressure is a different major reason for stopping. Smoking is today viewed as smelly, nauseating and disgusting by non-smokers as well as by a lot of the over 50 million ex-smokers in our nation. While smoking was once believed to be sophisticated, individuals who smoke nowadays are scorned by many of their peers. A few smokers now feel that they appear lacking in self-discipline and looked down upon for not bearing the intelligence to stop. A few wish to stop smoking to set a positive example for their youngsters. The expense of smoking is a different major reason. Many remember stating, "If cigarettes ever reach $1 a pack, I'll stop." Now cigarettes are approaching 5 times that amount, and these same individuals have continued to smoke. A smoking couple may be motivated to quit once realizing they're spending thousands of dollars a year to maintain their addiction. Besides, smokers burn holes in their clothes, automobile, furniture and carpeting. Not only may costly burns result, but accidental fires may be started. As a matter of fact, over half of the fire deaths in our nation are induced by cigarette smoking. Many have quit smoking previously for a significant time period and returned to smoking. When they were free from smokes, they felt healthier, calmer, and happier. But lack of comprehending allowed them to tempt a puff. This resulted in reinforcement of their full-fledged addiction. Some individuals need help to quit smoking. They know the dangers, plagues, and expense but still can't stop. Cigarette smoking is an addiction. It's imperative to remember that once you're an addict, you're always an addict. Once you're off smoking for a short time period, staying off is relatively simple. You'll have occasional thoughts for a cigarette, but they're nothing compared to the urges encountered from withdrawal during the early stopping process. But you must always bear in mind that one puff will put you back to a state of fully fledged dependency. Then you'll either have to go back to smoking or once more go through stopping. Those are both icky options. Consider both of them if you consider taking a puff. Follow the winners and never accept another puff. 2. Stopping gradually. Stopping by the gradual detachment method. If you know a smoker who they truly despise, you ought to actively encourage them to abide by the gradual detachment, cut down, approach. Call them up daily and tell them to just do away with 1 cigarette. Meaning, if they commonly smoke 40 a day, simply smoke 39 on the first day of the attempt to stop. The following day they should be promoted to smoke only 38, then 37 the next day, and so forth. Then you should call these individuals daily to congratulate them and encourage them to continue. I must re-emphasize, this ought to only be done to a smoker you in truth despise. A bit at a time. Most smokers will agree to this plan of attack. It sounds so simple to simply smoke 1 less every day. 39 cigarettes to a 2-pack a day smoker looks like nothing. The trick is to convince the individual that you're merely trying to help them. For the first week or 2, the one downside is you have to make believe to like the individual and you have to talk to them daily. They won't whine too badly either. When they're down to 30 from 40, they might start to complain a little. You truly won't be having fun yet. When the payoff comes is about 3 weeks into the scam. Now you've got them to less than only half their normal amount. They're in moderate withdrawal day in and day out. A month into the plan of attack, you have got them into pretty major withdrawal. But be relentless. Call them and tell them how awesome they're doing and how proud you are of them. If they're in their 35th to 39th day, you have pulled off a major coup. This poor individual is in extreme withdrawal, suffering miserably and having utterly nothing to show for it. They're no closer to stopping withdrawal than the day you began the procedure. They're in chronic withdrawal, not treating him or herself to 1 or 2 a day, but really depriving him or herself of 35 to 40 per day. If you wish to go in for the defeat, when you have them down to 0, tell them don't worry if matters get rugged, simply take a puff every once in a while. If you are able to get them to fall for this, taking 1 puff every 3rd day, they'll remain in withdrawal eternally. Did I mention you truly should despise this individual to do this to them? It's likely the cruelest practical joke that you may ever pull on anybody. You'll undercut their chance to stop, make them suffer infinitely, and likely they'll at some point give up, return to smoking, have such fear of stopping as of what they experienced cutting down, that they'll go on to smoke till it kills them. Like I stated, you better truly despise this individual. Hopefully there's no one you despise that much to do this to them. I trust nobody despises themselves enough to do this to themselves. Stopping cold turkey might be hard, but stopping by this withdrawal method is nearly impossible. If you have an option between hard and out of the question, go for hard. You'll have something to show at the end of a difficult process, but nothing but wretchedness at the end of an out of the question approach. Stop cold and in 72 hours it eases off. Cut back and it will essentially get progressively worse for weeks, months, or years if you let it. I ought to mention, this isn't a new method. Talk to every long-run ex-smoker you know. Attempt to find one individual who successfully used the cutback approach, bit by bit reducing to eventual 0 over weeks or months. You'll be hard-pressed to find even one individual who fits this bill. One other view that ought to help you see the flaw in the attack. Look at individuals here who had once stopped for months or years and then relapsed. One day, after such a long time period, they take a drag and are smoking once again. If 1 puff may do this after years or decades, guess what it will do after months or days of being smoke-free? It puts the smoker back to square one. All that any ex-smoker has to do to prevent relapse or chronic withdrawal is to never accept another puff. 3. 1 hour at a time. This concept is instructed by almost all platforms which are committed to dealing with substance abuse or emotional battle of any sort. The reason that it's so often quoted is that it's universally applicable to almost any traumatic situation. Take every day as it comes. Take it as it comes. Dealing with giving up smoking is no exception. Along with don't pick up another cigarette, take every day, even every hour as it comes is the key scheme which supplies the smoker the forte to successfully quit smoking and stay free from the powerful grip of nicotine addiction. When first quitting, the concept of take every day or every hour as it comes is clearly superior to the smoker believing that he will never smoke again. For once the smoker is first giving up smoking, he doesn't comprehend whether or not he wishes to go the balance of his life without smoking. Most of the time the smoker pictures life as a non-smoker as more trying, dreadful, and less amusing. It isn't till he ceases smoking that he recognizes his prior thoughts of what life is like as a non-smoker were wrong. Once he quits he recognizes that there's life following smoking. It's a cleaner, calmer, fuller and, most significant, healthier life. Now the thought about coming back to smoking gets to be a repulsive concept. Even though the fears have elevated, the take every day as it comes scheme ought to still be maintained. Now, as an ex-smoker, he all the same has foul moments at times. At times due to tension at home or work, or unpleasant social spots, or to another indefinable trip situation, the want for a cigarette rises. All he needs to do is say to himself, I won't smoke for the remainder of today, tomorrow I'll worry about tomorrow. The impulse will be over in minutes, and the following day he likely won't even think about a smoke. However, take every day as it comes shouldn't only be applied when an urge is present. It ought to be practiced daily. From time to time an ex-smoker believes it's no longer essential to think in these ways. He goes along with the idea he won't smoke again for the rest of his life. Presuming he's correct, when does he pat himself on the back for achieving his goal? When he's resting on his deathbed he might enthusiastically exclaim, I never picked up another cigarette. What a grand time for positive reward. Daily the ex-smoker ought to rouse thinking that he isn't going to smoke that day. And every night before he turns in he ought to compliment himself for sticking to his goal. As pride is important in remaining free from smokes. Not only is it important, but it's well deserved. For anybody who's quit smoking has broken free from a truly mighty addiction. For the first time in a long time, he's gained control over his life, rather than being commanded by his smokes. For this, he ought to be proud. So this evening, when you hit the sack, pat yourself on the back and state, additional day without smoking, I feel grand. And tomorrow once you wake up, state, I'm going to go for another day. Tomorrow I'll think about tomorrow. To successfully remain free from smoking, take every day or even every hour as it comes and never pick up another cigarette. 4. Motivation. Over the years I've found many smokers attempting to quit, totally against their will, who still manage to come through in quitting smoking. I from time to time see young individuals who are being coerced by their parents to lay off. At times it's adults who are forced by doctors, while other times it's adults who have been tricked into going to seminars by family and friends who literally take them to the curriculum under some kind of false pretense, like they're just going to dinner. While I won't state this maneuver works in the bulk of cases, it works far more often than most people would believe. Getting started to state that these people had no prior motive or want to cease smoking would likely not be true. I guess most smokers have a little level of motive to cease, but motive without an understanding of nicotine addiction and its treatment isn't enough to succeed. That's why most seminars attempt to ram in information as fast as possible. The important things to understand are why people smoke, why they ought to cease, and how to stay free. All 4 of these areas are crucial points of understanding for a person pondering laying off. Without a firm grasp of every element, the smoker will be disabled in his or her work to cease. Comprehending why he or she smokes helps the smoker detect that all the magic qualities associated with smoking were based on fallacies and feelings. While most smokers trust they smoke because they wish to, the real reason they smoke is because they have to. They're hooked and their bodies are requiring that they smoke. They're drug addicts, plain and simple, and realizing this premise is the crucial opening move. As with any other addiction or 12-step program, the assumption of being powerless over the drug is the first step in recovery. You have to realize that while you thought smoking was keeping you calm, it was truly increasing your tension levels, or more precisely, your reactions to tension. While you trust smoking makes you energetic, in point of fact, it's robbing you of endurance and power. While smokers often feel that smoking allows you to have fun and lead more socially active life styles, it's truly impairing and restricting your power to enlist in a lot of activities and to formulate fresh relationships. As contrary to raising your power to be vivacious and active members of society, it's in point of fact inducing you to resort to a lot of asocial demeanors. It led you to smoke in position of human contact, oftentimes leaving assemblies or declining to attend functions where smoking is no more permitted. Why a person ought to quit smoking is likely the least surprising sort of info, as many smokers already comprehend that smoking is bad for them. The issue is that most people don't realize how bad it is. Many are overwhelmed when they amply recognize the true magnitude of the dangers of smoking. The realization that quitting smoking is in point of fact a battle for survival is often of predominant importance in long-run success. This info is often vital for dealing with the occasional thoughts that are still sparked off by conditions and situations faced throughout the ex-smoker's life. How to cease? Now this is a shock to most. Individuals initially quit because they begin to realize smoking is killing them. They then discover that the huge majority of these people quit cold turkey. I've seen the power of education work thousands of times in helping decently prepare smokers to cease. Again, that issue is more than simply instructing the physical perils of smoking. It means the smoker builds up a full grasp of the physical, mental, social, economical, and aesthetic significances of smoking. I've likewise witnessed personal understanding develop into a mighty tool utilized by thousands of ex-smokers in keeping up their resolve to stay away from smokes as well. They'll maintain their resolve so long as they go on to value why they quit in the first place, and keeping those reasons in the forefront of their awareness. Might we motivate a smoker to wish to quit? I think a lot of smokers who have smoked cigarettes for any appreciable period of time are already motivated. While possibly not all smokers as a whole, it's likely that any smoker who turns up at a quit smoking clinic on his or her own accord, or who's typed the words "stop smoking" into a net search engine, has some initial concern and wants more information on how to quit. So essentially, the answer to whether or not a person may be motivated to want to quit is yes. As a matter of fact, most smokers already have a little motive in place. Comprehend that to quit smoking and remain off cigarettes and save your life. 5 tips. Smoking hurts not just the smoker, but also loved ones, colleagues, and other people who breathe the smoker's cigarette smoke, called second-hand smoke. Amid infants to 18 months of age, second-hand smoke is affiliated with as many as 300,000 cases of bronchitis and pneumonia every year. Second-hand smoke from a parent's cigarette step-ups a youngster's chances for middle ear troubles, causes coughing and wheezing, and worsens asthma circumstances. If both parents smoke, an adolescent is more than twice as likely to smoke as a young individual whose parents are both non-smokers. In homes where only one parent smokes, young individuals are likewise more likely to begin smoking. Pregnant women who smoke are more likely to deliver children whose weights are too low for the baby's healthiness. If all women stop smoking during pregnancy, about 4,000 new babies would not die every year. The info getting prepared to stop. Arrange a date for quitting. If possible, have an acquaintance stop smoking with you. Notice when and how come you smoke. Attempt to find the things in your daily life that you frequently do while smoking, like drinking your morning cup of coffee or driving an automobile. Shift your smoking routines, keep your smokes in a different place. Smoke with your other hand. Don't do anything else while smoking. Think about how you feel if you smoke. Smoke only in particular places, like outdoors. If you want a cigarette, wait a couple of minutes. Attempt to think of something to do rather than smoking. You may chew gum or drink a glass of water. Purchase one pack of cigarettes at a time. Shift to a brand of cigarettes you don't like. The day you lay off. Do away with all your smokes. Put away your ashtrays. Shift your morning routine. If you eat breakfast, don't sit in the same place at the kitchen table. Remain busy. Once you get the urge to smoke, do something else alternatively. Carry other things to place in your mouth, like gum, hard candy, or a toothpick. Honor yourself at the end of the day for not smoking. See a film or go out and enjoy your pet meal. Remaining quit. Don't fret if you're sleepier or more short-tempered than common. These feelings will pass. Attempt to exercise, take walks or ride a bike. Think about the positive things about quitting, like how much you like yourself as a non-smoker, health advantages for you and your loved ones, and the example you set for other people around you. A positive attitude will help you through the hard times. If you feel tense, attempt to keep busy, consider ways to solve the issue, tell yourself that smoking won't make it any better, and go do something else. Consume regular meals. Feeling hungry is occasionally mistaken for the want to smoke. Begin a money jar with the cash you save by not purchasing cigarettes. Let other people know that you've quit smoking. Most individuals will support you. Many of your smoking friends might want to know how you quit. It's great to talk to other people about your quitting. If you slip and smoke, don't be disheartened. A lot of former smokers tried to stop numerous times before they finally succeeded. Quit once more. Wrapping up. Quitting smoking makes a difference right away. You may taste and smell food better. Your breath smells greater. Your cough disappears. This occurs for men and women of all ages, even those who are older. It occurs for healthy individuals as well as those who already have a disease or condition induced by smoking. Quitting smoking cuts the risk of lung cancer, a lot of other cancers, heart disease, stroke, other lung diseases, and other respiratory diseases. Ex-smokers have better health than present smokers. Ex-smokers have fewer days of sickness, fewer health complaints, and less bronchitis and pneumonia than present smokers. Quitting smoking saves cash. If you need more help, see your physician. He or she may prescribe nicotine gum or a nicotine patch to help you crack your addiction to smokes.